I'm Dr. Clare Spencer, a menopause specialist and GP and co-founder of My Menopause Centre. Sleep is a really common issue for many women as they transition through the menopause, which can have a really significant impact on how you feel during the day. And the reasons for it are many. So we know that sleep can be affected by changes in hormones, by drops in the levels of hormones, but also there can be a knock-on effect of symptoms of the menopause. So for example, night sweats waking many women at night, and they can find it hard to get back to sleep. The same goes for needing to get up and going to the loo to pass urine in the night, and for many women also joint aches and pains. And also the psychological symptoms of the menopause can impact on sleep. So anxiety, waking up feeling anxious in the night with those intrusive recurrent thoughts. And the same goes for low mood also. If sleep is affecting you, or loss of sleep is having an impact, there are many different ways of tackling it. So during the day, avoiding caffeine, particularly after lunchtime, because the half-life of caffeine is really quite long, so it can linger in your system for a number of hours after you've had a caffeinated drink. And alcohol can have a really big impact. Many women will tell me that they're drinking to get off to sleep, having a glass of wine at bedtime, but actually the quality of sleep after you've had a glass of wine is not as good as if you go to sleep naturally. So that can have a negative impact rather than positive impact. Also, we know that exercise, particularly vigorous exercise, can have a really positive impact on sleep and sleep quality. It's really good to get into a good routine, to practice good sleep hygiene. So a good bedtime routine can have a really positive effect. So making sure you're avoiding screens, you're avoiding, particularly there seems to be something to do with the light, the impact on light from looking at your screen late at night just before you go to bed. And also making sure that you're relaxing at bedtime. So have a time, whatever it is that you like to do, whether it's having a bath or using a meditation or relaxation app, that can be super helpful for getting to sleep and staying asleep. If you do wake up in the night, then there's evidence to show that if you lie in bed awake, it's almost like you dissociate your bed, your bedroom with sleep. So if you find that you're lying awake at night for more than 15-20 minutes, it is better to get up, either make a decaffeinated drink or something, and then go back to bed again after and to try and get back to sleep. And again, using a relaxation app, using one of the sleep apps can be helpful at that point. There is really good evidence that cognitive behavioural therapy is helpful also. HRT can be helpful for sleep, both directly and also by helping manage menopause symptoms. There is other medication that can be helpful for sleep. So if sleep really is affecting your quality of life, if it really is very difficult for you, then please talk to your GP or other healthcare professional about it.